For the performance, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol, and explain to client what you are going to do, why it is necessary, and how he or she can participate. I'm Katrina Estrellado from BSN 1-4C, and what I'm going to do is to assess and change your wound dressing and get the sample on your wound. Now, may I know your name? Okay. So now I'm going to perform my hand hygiene and observe other appropriate infection control the procedure. And now I'm going to provide for clients' privacy. And now I'm going to wear my gloves or my clean gloves. So I'm done wearing my gloves. Now I'm going to remove the outer dressing and observe any drainage on the dressing. Hold the dressing so that the client does not see the drainage. And now I'm going to discard the dressing in the moisture-proof bag. Handle it carefully so that the dressing does not touch the outside of the bag. Now I'm going to remove and discard my gloves and perform my hand hygiene. Now I'm done wearing my gloves, and now I'm going to assess the wound. After that, cleanse the wound with normal saline. Now I'm going to remove and discard my sterile gloves. Now I'm going to perform my hand hygiene. So I'm done doing my hand hygiene. So I'm done wearing my gloves or my clean gloves. Now I'm going to open a specimen tube and place the cap upside down on a firm, dry surface so that the inside will not become contaminated, or if the swab is attached to the lid. Use the cap to loosen the swab. Hold the tube in one hand and take out the swab in the outer. So I'm done collect the aerobic culture. Now I'm going to close the tube or the specimen tube. Now I'm going to dress your wound, but before that I'm going to cleanse your wound using my cotton applicator and my betadine. Now I'm going to disregard the cotton applicator. Now I'm going to cover the wound with the sterile wound dressing. Now I'm done dressing your wound. Now I'm going to remove and discard my gloves. Now I'm going to perform my hand hygiene. So now I'm going to document all relevant information, record on the chart the taking of the specimen and source. So thank you for your cooperation.